Liz.
Nice to meet you.
You too.
So are you local to Carlow?
I am. I just live half an hour out the road. And
County Carlow, Carlow.
County Carlow, on the border, but we are Carlow. We built a house out there 2 years ago. So, enjoying living in Carlow.
Where did you study your dentistry?
In Dublin, in Trinity, yeah.
How long are you a dentist now?
Since 2008. Yeah,
Okay.
graduated.
10 years.
Yeah, almost, yeah.
Wow, that's extraordinary.
Yeah.
And how long are you with the Pembroke Dental Clinic?
I started back in 2009. I graduated in 2008 and then I did a vocational training programme in Ireland. I did a couple of months in Kilkenny, a couple of months in Carlow with the HSC, and then I moved to Pembroke in 2009. Lucky enough, because it's a great practice.
How many are here actually on a daily basis every day?
There's approximately 6 dentists, so then some work full-time, some work part-time, but yeah, it's a busy practice, and we've specialists come here as well.
And you mentioned there that you did some work with the HSE, and I remember when my own kids were in national school, I took them to the HSE because they had the free dental checkups, I think every second year from first class or second class.
For sure.
Isn't that right?
Yeah.
And it was a brilliant service.
It is, yeah. It's fantastic service for kids. We do have a lot of kids here in Pembroke, and purely probably because I see a lot of families, and the families like to tend to bring their kids in as well. We see anything from 1-year-old right up to teenage years, and then we see them coming back as adults. So yeah, they tend to go to the HSE, but I find a lot of the kids come in with the families, and then they're in to get their Fisher seals done, and they're happy.
It is brilliant, I have to say. We are in a new time now. I mean, I'm a little bit older than you, and I can tell you when I was a child, going to the dentist was just a horrific thought. And times have really very definitely changed.
They have. An awful lot of my patients would be the nervous patients, very, very nervous, and they often come in very apprehensive, very embarrassed about their smile, and they just say, "Oh, don't judge me," and they're really, really upset.
That's quite sad, isn't it?
Very upset. And so we have a chat, and we get to know each other a little bit more, and we start off. A lot of these patients may have avoided the dentist for maybe 10 years.
Wow.
So we get a plan sorted, what we need to do. We start at the very beginning. We start with the simple things like cleaning and maybe some fillings, and then we have it all written out for them, and costs and how they want to sort their finances, and then we often leave the bigger stuff till the end. And then one of the most rewarding things about being a dentist is seeing those nervous patients coming back at ease, smiling, not nervous. They often come in crying on the first few visits, but then after months, even years, it's not a bother to them. I think once they've been in the first time, they understand there's no judgment. We're here to help. We're here to improve their self-confidence and to get them the smile that they want. And a lot of people just want that smile that they can be happy in photographs and be proud of. And sometimes it only takes maybe a wee filling or a little bit of cleaning or whitening. Other times we have to do things like veneers and crowns and braces. We've a service called Fastbraces here in Pembroke.
Fastbraces?
Yeah.
What's Fastbraces?
So Fastbraces is a new technology out, and it's something I've always had an interest in orthodontics, and it's something that I've pursued and furthered my education in. So it's easy, it's quite fast.
Are they the train track
they
braces
are the
that
train tracks.
that the kids would call the train tracks?
Yeah. It's an American company, and they have patented this bracket, and it actually moves the tooth and the root quite quickly and efficiently. So it means that the process happens quite quickly. Sometimes only 3 months, more than likely up to 6 months.
No way.
Sometimes 9 months. Yeah. So it's a very efficient
system. As opposed to 15 or 18 months.
Yeah. Look, there's always those patients that need the treatment over the 2 years, and when we do that, we refer to the appropriate orthodontist. But you wouldn't believe how many people come in. A lot of brides come in saying, "Look, my wedding is in a year's time. I want the little front tooth straightened out. I want the bottom teeth straightened out." And this is a perfect solution for that. They come in. It's very simple. There's not much pain because of the position of the bracket, and it all happens quite quickly. And then in 6 months' time, they have their teeth straightened. They're ready for their wedding, and the retainer goes on the back, and the teeth are secured. So
I have to say, aesthetically, I'm starting to realise that a smile is critical and very, very important to
It
everybody.
is. And you know what? Especially I see men as well. Everyone says, "Oh, men don't mind about their smiles." You wouldn't believe how many young men in their 20s, 30s are coming in saying, I want my fast braces done, I want their teeth straightened. They don't want a long-term plan, but they want them straight enough that they can be happy with their smile. You know, probably as teenagers, boys and teenagers weren't that interested, but I find men as well as women want the perfect smile.
You are clearly very passionate about your job.
I am passionate about my job, yeah. And I enjoy my patients. I have great fun with patients, and I've enjoyed getting to know them over the years. I've been here almost 10 years now, and it's been fantastic. I've seen kids grow up and adults come back year after year, and you get to know them, you get to know their hobbies, they get to know my hobbies, and we have a good relationship with patients.